So I've got Dawn Hodson, the CEO of Reducing the Risk Domestic Abuse Charity.
That's correct.
I got there. So really great to have you on the podcast today.
Thank you very much for inviting me.
And we had a good chat yesterday, didn't we? And
We did indeed.
Looking forward to discussing more with you on the podcast. So yeah, just I guess first of all, introductions. I've introduced the name of the organisation, but tell us about the mission, and I guess how you've come to be CEO of it, and your mission as CEO.
So the charity started in 2007 in my kitchen. And it started because there was sadly a number of domestic homicides in the area where I worked, and I was the domestic violence coordinator at the time. And
for a council.
For a council, yeah. And what we noticed was that these individuals had reached out for help, but nobody could help them. And so it was just at the point where we were nationally, they were developing these roles called independent domestic violence advisors. And we thought in 2007, let's set up a charity, as you do when you're young and you have no idea how difficult it's going to be to set up a charity. And so we set up the charity initially to employ these advisors who would give direct support to victim survivors. And in the last 20 years, I haven't been CEO for the last 20 years. I went away and worked in other places so I could have the skills to come back to be the CEO.
Okay.
But the charity grew from one individual, and now we have got a training arm. We've got a network of domestic abuse champions across the country. So we've got 7,000 of those right across the country. And we deliver direct services. So we support those individuals who are high risk of domestic abuse. So those individuals at serious risk of harm or death. And we also have got a court service, because when people go through court, it's so stressful for them, and going through a criminal investigation is so stressful. So we support individuals going through the court process as well, and that's in Oxfordshire and other areas across Thames Valley, and the high risk service is just in Oxfordshire. And so I came back because I could see what we were doing as a charity was different. It was innovative. We were getting great feedback from our clients, and I wanted to come back and tell people about what the charity had done for the last 20 years and how it supported thousands of victim survivors and their children, and how what we were doing was different. And so our network is 7,000 now. And so when we've had the independent research, they tell us that they know what to do, they know where to go, and they're really a lot more confident in supporting victim survivors. And so that's my mission.
And so just for that, and that's a brilliant overview, and amazing to hear what all the amazing work you've done. So I'm just for the casual listener, when you say clients, then are they the people who refer people to you, or are you talking about victim survivors?
Victim survivors, yeah.
Okay.
Yeah.
Okay.
So yeah, those victim survivors that come forward.
Okay. And do just in terms of how it works, do most of the victim survivors come to you directly, or is it a matter of the partnerships that you've got with people like councils and the court service? And
they all come through a referral route from one of our champions, and from the individuals who've had training around risk assessment. And so the pathway locally is a risk-led pathway, and so there's a risk assessment done. People think somebody might be a high risk of serious harm, and so if they can't do the risk assessment, they will find somebody and get supported to do the risk assessment, and that's when they come into us. It's
expertise to the front line.
Yes.
Yeah.
So we're about empowerment, and we're about support, we're about knowledge, we're about engagement, we're about building those links and relationships. And so we always say we're not about delivering training, we're about building partnerships. That's the whole thing.
Yeah, absolutely. So, and how is that? So you mentioned you've obviously over the 20 years you've had different relationships. How has the organisation evolved then over that time? Like, obviously it wasn't then what it is now. And what's that journey been like?
So when we started, we had one worker. Her name was Trish, and Trish is still with us, and she's the service manager. And so the ambition at that point was to develop a service that walked along beside the survivor to make sure they were protected, they were safe, but also to help them with that initial kind of emerging from the control, the abuse that had gone on, but also help them through the recovery phase until they felt more confident to be able to stand on their own 2 feet. And so fundamentally, the difference between us and other charities that work in the sector, and they're all brilliant, is that we commit to walking alongside the survivors, the clients, for as long as they need us.
Okay.
So on average, the national data set says somebody will be supported by a independent domestic violence advisor for about 15 weeks. We are more than double that. And so we will stay with people for as long as they need us, because like anything, we're here today looking at health and well-being. A lot of that is over the longer period. A lot of that is about relationships. A lot of that is about building your self-esteem and being supported by individuals. And I don't think you can do that in sharp shocks of 15 weeks.
Yeah, and it's the equivalent of, if somebody's off work with depression and anxiety, or it's a condition of that sort, you can't just send them off for 4 weeks and then they're going to come back absolutely fine, can you? It's about that. What is that system around the person? How are they coping with that themselves? How's their family supporting them? How's the employer supporting them? And what environment are they going back into? I guess it's so there's parallels. Yeah,
it is very much so. And I think that relationship building for us is really important. And one of the reasons we started to, today we're talking about launching our new initiative, which is for employers. And that came about because we've got this network of domestic abuse champions, and we had a number of people in HR who were, we've got one in a big employer who was saying to us, I've supported 175 members of staff who, some have been in a relationship with the perpetrator, some of them are perpetrators, and so I'm supporting people in the workplace. And when the Domestic Abuse Act came out in 21, which says work employees have to think about domestic abuse as part of their employee responsibilities, we thought, actually, people have been telling us this for a while. Our champions come forward, they're part of HR, but we need a specific offer. And so we spent the last 2 years working with employers, going from a small local pub up to multinational kind of organisations and banks to help us to say, what is it that you want at a small pub that you would want as a big multinational? And fundamentally, and you'll know this from the health and wellbeing work you've done, it's kind of the same thing.
Yeah.
It's just the scale is slightly different.
Yeah.
They all need support, they all need resources, they all need empowerment, they all need knowledge, and they all need relationships.
Different mechanisms of delivery depending
Yes,
on.
yeah. So, I did a pub a few weeks ago, and I just went there after the doors were shut, and I worked with them around raising their awareness, because one of their members of staff had been subject, and they wanted actually to be aware. And so they've taken that, and they have put posters in their toilet. And similarly, we're working with large multinationals, and they're saying, well, actually, can we have some posters that we can download? Because we want to make the environment a place where people think this is something okay to talk about, like mental health, like all well-being conversations. We want to feel the people we talk to have got some insight and understanding.
Yeah. It's a great channel, the employer channel, to raise awareness. So what's that pivot been like from the traditional referral social services type route to the employer? What have you learned along the way from that? Because it is like you say, it's the same issue, but it's a different context for the conversation.
We have learned so much, and we have worked a lot with advisors and corporates because we went in with the mindset is like, everybody clearly wants training, everybody clearly wants this, and obviously when you're working, as you say, in a social care setting, the knowledge and depth of knowledge you need for the clients that you work with who are living and experiencing this every day are different than an employer who might come across a member of staff, on the odd occasion, or more than on the odd occasion if they're rather large. And so the pivot we had to learn was listen more, talk less.
Okay.
Because we were very good at the talk. We knew exactly what we wanted to sell people, and we go, this is so important, you need to really listen to us. as you can tell, I'm a bit passionate, and as you can tell, I can talk for England. And so our big pivot was listen more, listen to what that employer is telling you they want for their organisation, not what you think they need, and then help them to make sense of it initially. And so what we're finding is we're going in small. People are saying, can you help me write a blog for the intranet? Have you got any posters we can advertise? What can we, can you do a awareness session for an hour? And as soon as you start those little things, suddenly people start coming forward, exactly like mental health, exactly like well-being. And then they go, oh, can we have a bit more? And that's where the partnership comes in, because actually we say,
respond quickly and get
because this is a relationship. So we our champions network is, when people come to us, they know what they want, and when employees come to us, they know they want something, but they don't think they need a lot, but they don't know what it is. And so we spent a long time learning how to listen and engage with employees where they are, not where we are.
It's a really interesting point. That is. I mean, so since leaving my corporate job, I've done work helping health and wellbeing businesses to grow and get to meet their goals and do the things they want to do. And that's the number one theme that I've taken out of it, is that everyone I've worked with is so passionate about their product and their subject and helping, generally. But it's often they really need reminding that the person they're talking to has got this whole other set of stuff going on and a context. So it's really about, which it sounds like you've come to that conclusion, that it's about understanding that conversation that's going on in HR departments and broader organizations, and being able to hook in. The person you're talking to about this topic, they're probably also thinking about the DEI rollout, the health and wellbeing survey that's going out next week, and what the results of that are going to tell them about certain things. And they're thinking about, how does this all fit together, and which bits, what can I want to do this, but how can I do this, and what do I need to take account of dependencies? It's all of that, isn't it? And I think eventually you get the rhythm of that conversation.
Yeah, it's taken us 2 years of feeling like we're going down not exactly the wrong avenue, but thinking maybe that wasn't the right way to do that. Because you're a charity, you're used to dealing with people who come to you because domestic abuse is an issue for their clients. And actually, when you move into the wellbeing space, when you move into the much more the prevention discussion, much more the responsive discussion for employees who their job isn't, their clients in the main aren't people who are experiencing domestic abuse. Their clients are people who have got a bank account. Their clients, they might be building a road, they might be building a house, and that's who they are, and that's who they're responding to. So I think there's
a cultural thing there, right? Because you're thinking, why do they, culturally and values wise, why do they care about this? Why should they care about it? And helping them to understand why they should care about this.
And so our proposals now are more like business cases, because the person you're speaking to, usually it's not unusual for them to have a lived experience or a family with a lived experience. So they themselves are passionate. And so our proposals are like mini business cases. And so we tell them the moral reason, we tell them the ethical reason, we tell them the legal reason. And then, I think I was saying yesterday, Ben, we were very lucky to have a merchant bank do a costing tool for us. And so that's just blown people's minds to say, we can tell you now what the financial burden on your organisation is from domestic abuse, where 5% of your staff at any one point are living with it.
So some pretty big numbers coming out, weren't
It's pretty big numbers.
Yeah.
I mean, there was we did a global bank last week, and it was £49 million it's costing them. On average, it's between £10,000 and £20,000 an individual. And there's a lot of health at this at the event, isn't there? And so occupational health, especially from a health sector, you can't not have somebody on the ward. And so not only are you losing the cost of them being into work, you're having to pay £50 an hour for, that's an extra 150 quid a day for a shift, or 500 quid a day for a shift. And so they're saying, actually, we have to find somebody to cover the shift. We can't not have somebody on the ward.
So you put the moral and the financial together, it's compelling.
Yeah. That's what we're hoping anyway.
Yeah.
That's
And you're finding that's cutting through into.
it is. It's really interesting. Saying we've got a tool. We were testing. We were trying to use the tool yesterday, but actually, what we found it was getting in the way of the conversations. People just wanted the conversation, and so we cut out the tool and said it costs you between £10,000 and £20,000 for a member of staff who's living with domestic abuse. We can do it personally for you. So we've got a webinar on Friday launching this, and we've had I think 40 sign-ups since yesterday, and so we're off the 100 now. Where we had 60 I think when we started, which for us is brilliant. My target was 10 a day, and we've spoken to probably 130, 140 people. And
maybe
so
a tool like that is as well. Maybe that's actually more of the setup when you get in with them as well.
I think you're right.
Yeah.
I think you're right, because we thought, people will only speak to us because we're able to tell them how much it's costing.
Yeah.
Actually, no. Everybody's here because they've got a real interest in making things great for their staff. And the biggest conversation we're having is what percentage of my staff, and what's happening when they come to work. And when you say, well, for that 5% who are being affected now, they're getting harassed, texted, contacted at work. And so 75% of them are being contacted while they're at work, which is affecting their productivity for 90% of them. And so nearly 100% of the people who are living with domestic abuse now is having an impact on their productivity at work. And they're all going, I did not know that. I did not know that.
Yeah.
So
you can get to the headline of it quite quickly, can't you?
Yeah.
You almost use it in with them when you're working with them to delve down a little bit. It's a bit similar to, I do a thing with Readiness for health and well-being, and you can either use that diagnostic view of 8 states of readiness, for example, to start a conversation, but you could also use it as the start of helping somebody to delve down into that, and like, where are we actually going to start, and structure your approach to helping them develop as an organization around that. So, it's horse for course, isn't it?
Yeah, it is. But I think what you said earlier is really important, is start where the employer is, not where you want them to be.
Yeah.
And it's bizarre, because that's what we teach in our domestic abuse training. And don't speak to a victim survivor where you want them to be. Are they ready? They're not ready to leave.
Yeah.
You want them to leave. You want them to be there. But speaking to somebody who's not there, means they won't speak to you again, or likely not to want to speak to you because you weren't in the right frame of mind, or you weren't the person they wanted to speak to.
Readiness is a really key theme, isn't it? Both at an organisation, but an individual level as well.
Yeah. When I used to deliver training, the first thing I used to do, and I haven't done it for a while, maybe I should reintroduce it, is where are you on your readiness? Are you motivated? Are you engaged?
Yeah.
Have you got insight as to why you're here?
Yeah.
And is there anything practically, because mine's not 8, but is there anything practically which is getting in your way, which is stopping your ability to learn today? And just doing that gives people the opportunity to go, well, there's this that I need to park, or there's this that I need to do. Because I think that readiness is really important, because if you're not ready, and it's okay to say, I'm not ready now. Jaguar, when they're selling cars, don't they? They say there's only 1% of the people ready to buy a car now, but 99% of them will be ready to buy a car in the future.
Yes.
And so what I need to do is to make sure I'm on their list of cars that they're going to look for when they're coming to buy. And that's that's the message is, we don't deliver training, we want to build partnerships. So if you want to build a partnership, please come along and speak to us. If not now, some point in the future.
Yeah. And what's next then for you guys? It sounds like you're part way through the pivot, but it's going well. What's the plan for getting this even more out there, shall we say?
So we've done a lot of work. The last 2 years has been a lot of work getting us ready for the launch, and we've got a number of organisations over the line, because we have a certification process as well. So we've gone through that with a number of organisations, and so it's about getting people on that process and getting people wanting to speak to us about being a certified domestic abuse aware organisation. What does that mean? And that's about building awareness. It's about having the structures in place. It's not complicated, but it's about having a bit of a robust framework that they can work towards, to say, yeah, I've got that. Yeah, I've got that. Yeah, I've got that. Yeah, we can do that. And also building the community, because for us, as I said, it's not just about training; it's about building that community. So we want to get bigger, and getting bigger is because we think we've got a great innovative way of helping and supporting and empowering and building confidence for people to support their employers, to support their colleagues, to support their friends, and to get that out there in the workplace, really.
And I guess you'll iterate with this employer piece as well, because you're going to learn.
Yeah.
You're going to learn early, aren't you? Fail fast in a few areas, and that might become something different from what it is
Absolutely.
today.
It's already changed from when we started 2 years ago.
Yeah.
So and we took it to, we had some pro bono work from this bank, and they kind of benchmarked us. We're a relatively small, very small charity, and it was because I worked for a large charity previously, and I approached them. And they say, we don't normally do this we don't normally give 6 of our consultants to a tiny charity.
Yeah.
And I said, I think we've got something special. Could you have a look for us? And so they gave us 6 of their best. And they shook us up and down. They had a look at us from inside out. And then they did a great piece of work benchmarking us against what other much larger domestic abuse charities were doing, and how we'd approach things, and told us where we could improve, what we could learn from. But actually, the stuff we were doing really well. We get 12,000 hits a month on our website, and we honestly don't know why. Because it's and that's what they said. They said, why do you get 10,000? What SEO have you been using? And we went, SEO? What's that then? So I think there's always a lot to learn, and not to be too arrogant, not to think that we know everything, but to be flexible and responsive to the needs of the people we're trying to support, to the needs of the organisations we're trying to support as well.
Yeah. Brilliant. Well, listen, it's been an absolute pleasure talking to you, Dawn.
To you, Ben. Really good.
And I've learned a lot, but I'm also finding it really inspiring the work that you guys are doing. It's been fantastic to hear about.
And you as well. I see you're building a community, so I think that community approach is got to be the best way to go.
Yeah, definitely. And those guys will be really, really keen to hear about this. So it's absolutely brilliant.
Lovely. No, thanks for asking me along.
Thanks, Dawn.
Nice
Cheers.
speaking to you. Thanks, Ben.